go into more detail about that, but I think it's about as safe as it's going to get. You know, it's
Right.
technology, but it's not something that should have any type of long-lasting effect on the body.
Right.
Well, it's 7:33. I think we should give it 2 more minutes, and then I'm sorry, I'm on the East Coast. 6:33, 2 more minutes, and then we'll get started.
Okay.
If anybody on the Zoom, if you can mute yourselves, that'd be great. That way we won't have any feedback. We will be recording this. If you have any questions, please make sure to put them on the chat, and Dr. Wallace or Monica will be able to answer any of those questions as we go through. So please put them on the chat. Don't interrupt in the middle of the presentation, but you can put the chat on at any time, and we'll make sure during the question and answer session to get to those, because we want to answer any questions you might have. It's really important.
And just friendly reminder to hit record right before you start talking, Daniel.
I already started recording it. I figured
Okay.
they can hear our conversation ahead of time. I should probably stop the recording and start it again, but
No, that's okay.
by the time I miss the recording, they'll just have to hear it. They'll laugh at us. It's all good.
Right.
Give it another minute. See if anybody else jumps on. The great news here is we're going to be sharing this with all of our team tomorrow when we're done, and spreading it out to everybody. We have the ability to email and text these to everybody, so we're looking forward to that.
Wonderful.
Okay, let's get started. I'll make the introduction, and as people get on, that'll be great. So good evening, everyone, and thank you for attending BRIA Zoom education on the COVID-19 vaccine. My name is Daniel Weiss, CEO of BRIA Health Services. We're here today to talk to you about the COVID-19 vaccine. First, I'd like to introduce our presenting physician and key clinical staff. They'll be answering any questions that you might have. Dr. Lance Wallace is the medical director of BRIA of Chicago Heights. He graduated from Northwestern University with a degree in neurobiology and physiology. He attended medical school at Southern Illinois University and earned honors in internal medicine and obstetrics and gynecology. Dr. Wallace completed a categorical internal medicine residency at Evanston and Glenbrook Hospitals. He was the first African-American to be selected as the chief resident in internal medicine at this program, and was in charge of the teaching programs for the medical students, interns, and residents. Over the next 2 years, Dr. Wallace fulfilled his Illinois Department of Public Health scholarship obligation by providing medical care to homeless individuals, overseeing a tuberculosis surveillance and prevention program, an HIV clinic, and providing care to Cambodian victims of torture. Dr. Wallace began practicing internal medicine in the southern suburbs of Chicago in 1995, and has served in multiple administrative positions and specializes in quality and performance improvement. He currently is the medical director for quality assurance and performance improvement for Specialty Physicians of Illinois. He also serves as the post-acute care network physician champion for the Franciscan St. James Hospital. Dr. Wallace has been the physician representative to the COVID-19 task force for the South Suburban Cook County region for the Franciscan Alliance since the outbreak began. And he strongly believes in the empowerment of all people through education. Monica Schreck is the BRIA Director of Clinical Operations. Monica leads the BRIA task force and is working every day to make sure all BRIA team members have the supplies, education, and knowledge to stay safe in this COVID environment. Today, I'm here to encourage you to get vaccinated. As brave heroes, you have seen every day how COVID-19 has torn through our residents and each of your team members. So many have become sick and many have perished. The only way to stop the spread of this disease once and for all is if we all get vaccinated. Now I'd like to turn it over to Dr. Wallace for his presentation. If you have any questions, please put them on the chat and we'll make sure to get to them. Thank you, Dr. Wallace.
Good evening, and thank you, Daniel, and thank you, Monica. I'm honored to have this opportunity. I have, as Daniel said, we started this COVID-19 fight back in March. You know, I actually had COVID-19. I remember the date and time because it was that last week in March where they were saying don't wear a mask. And the day that they said wear a mask, I went to Ingalls Hospital because I've been seeing a patient that whole week. and the floor had been changed into a COVID-19 floor that day. And then I was driving home, and all of a sudden I started getting fever and chills. And the next day I had a test done, and I came back the following Tuesday that I was COVID-19 positive. I was luckily just had mild to moderate symptoms. But this truly is a stressor on all of us, and nursing homes in particular have been targeted because, you know, as a nursing home provider, you take care of some of the most complex patients, and that patient population is by far the most vulnerable. So we're going to talk a little bit about vaccines, but first I want to lay a little bit of groundwork. So COVID-19, basically, the name comes from coronavirus December 2019, because that's when it was first discovered. It's basically we believe they came from Wuhan, China, from a wet market where they slaughter the animals on site there. It's a very crowded situation. And you had coronavirus that's in the animal, and it was able to cross over to humans, given the environment that it was in. Coronavirus gets its name because the virus itself has these crown-like spikes. Everyone has heard about the spike protein that's on the outside of the viral molecule. And that spike acts as like a set of universal keys. It allows that infection to get into the cell, where it takes over the machinery of the cell and starts reproducing. And then from there, it starts spreading all over the body.
If everyone could please mute their phones or their video. Someone's not muted, if you could please mute. I'm going to go on and try to mute everybody.
So the virus basically evolved to infect humans. You know, viruses, when they have a very erratic reproduction pattern, and their RNA can be shared during that reproductive process. And that's basically what happened. You had people who have coronavirus, you had these bats that were dying, you had these other types of animals that the Chinese use for medicines, and they all sort of came together to form this super virus, which is highly contagious. And you know, we see how quickly it's spread across the globe. So these are the current statistics for the United States. You know, obviously it keeps going up every day. I did a presentation last week, and I believe I was below 300,000. Now we're significantly above 300,000. We've got more than 2,000 plus deaths a day. In Illinois, those are the statistics for Illinois. I mean, this is just really unbelievable. The number of cases we've had, the number of deaths, and the fact that we continue to have people dying every day in spite of the improvements that we've made in treatment. In terms of preventing infection, I'm just gonna go over this very quickly. You know, avoiding exposure is the key. You know, you're most likely gonna get exposed from someone you know as opposed to a stranger. That's one reason they emphasize, you know, not having these holiday gatherings. You know, you let your guard down, you have someone there who's asymptomatic, and they infect the whole house. I've seen this over and over and over again during the past several months. You know, wearing a mask, trying to social distance, washing your hands for at least 20 seconds. You know, it's really important to think about, if you touch your face, you touch your cell phone, you need to wash your hands. You know, that's very important, because it can sit on surfaces. No one really knows how long it can sit on surfaces, but, you know, keep that in mind. This is a highly contagious particle. It's airborne. It's about the size of a human hair. It travels easily on air, and it gets inside your nasal passages. That's very important. Keep in mind, when wearing a mask, you got to cover your nose. I see a lot of people don't cover their nose. You got to cover your nose. It may be inconvenient, but that's what you need to do, because that's where the virus wants to be, in the lining of the nose. So we talked about hand washing. If you don't have access to soap and water, then you can use a 60% alcohol containing liquid. We have most places have this. I know they're all over the BRIA facilities. Use this, carry it in your car. Wipe down your steering wheel. Make sure that you stay on top of things. Have wipes in your car. That's part of your preparation kit, is having those wipes and having like Purell, readily available. So these are some of the symptoms. A lot of times these are like initial symptoms: fever, cough, body aches, loss of appetite, loss of taste and smell. I have a lot of patients who, that loss of taste and smell is quite common. They call me with that, and that just sends up like a red flag to me that I need to test them. Sore throat, fatigue, and shortness of breath. Headache, nasal congestion. 10 to 15% of people will have severe disease, and 5% of people will be critical. So keep that in mind. Most people have mild to moderate symptoms. Treatment at home, rest. A lot of times people lose their appetite, so I recommend that you drink fluids, that you eat, fruit that has a lot of juice in it. You have small, frequent meals like soups, just to keep yourself hydrated. Vitamin D, everyone should be on vitamin D because everyone is vitamin D deficient. I'm just going to leave it at that. Zinc lozenges help because that zinc, when it gets to your mucosa, it makes you resistant to viruses. Breathing exercises, so that like if you're infected, it wants to stop you breathing. It wants you to not expand your lungs. So it's important to do the breathing exercises. Tylenol, air exchange in terms of the home. That's when you open the windows, you get all the bad air out and get the good air in. And then, just cleanliness and, be in contact with your physician. Your physician should be updated about every 48 hours on your symptoms. So these are mild symptoms. Moderate symptoms, when you start getting, more persistent fever, coughing, difficulty breathing with exertion, weakness. Those are things, that need closer monitoring. Warning signs, when you talk about constant trouble breathing, persistent chest pain or pressure, difficulty with your thought process, you're starting to feel confused, trouble staying awake. You start getting more of these types of symptoms, you need to go to the hospital. I tell people, call 911, get them come to the house, stabilize you. If you go to the ER, you won't be sitting out there in the lobby. They're going to take you right back and you're going to get evaluated much quicker. These are things that you should have at home: a thermometer, a pulse oximeter, measure your oxygenation, analgesic meds like Tylenol, Advil, Aleve, zinc lozenges, again, the vitamin D, and electrolyte replacement drinks. Some people, I don't think I mentioned it before, some people get diarrhea from COVID-19. So, you tend to become dehydrated. So you want to make sure you have those types of things at home in preparation. The pulse oximeter is important because obviously the respiratory issues are what, really indicate that things are going in the wrong direction. So being able to measure that and give that information to your doctor is key. So let's talk about the vaccines. So this is a novel approach, this mRNA vaccine. Back about 10 years ago, they started doing a lot of research in this area because a lot of vaccines are very labor intensive to develop and grow. The flu vaccine has to be grown in an egg culture, and there's a number of steps that have to happen in order to make it ready to be made into humans, to be used in humans. The mRNA, what that stands for is messenger RNA. It's basically a form of RNA that tells cells what to do. So the messenger RNA vaccine has been programmed they took a sequence from the COVID-19 virus, and that's the sequence of its genetic code that tells the cell to express the spike protein. So they program that into the messenger RNA. And so when you get the vaccination in your arm, that chemical starts circulating through your system and it goes into your cells and it tells your cells to express the spike protein. When they express the spike protein on the membrane of the cell, your body realizes that this is foreign and starts making antibodies to it. Like any infection, what the infecting agent tries to do is to sneak into your body. It wants to get in undetected, then start reproducing, and then start infecting other cells, and then more cells and more cells and more cells. If your immune system sees it initially as being foreign and knows that in no uncertain terms it should not be there and begins attacking it, it prevents it from getting a foothold. So that's the key thing about this. It prevents your immune system. I mean, it educates your immune system so it recognizes the virus before it can get a foothold in your body. And that's the key thing about the vaccine, is that it's preparing you. You don't have any known immunity to this. Your body's never seen it before. So it's just, key that it educates your active immune system to recognize it. It activates your immune system. Your immune system is almost like a branch of the military. If you have the Air Force or you have your Navy, you have different levels within each one of those branches of the service. And what this does is not only do you get the antibodies coming, but then you start your white blood cells, which are very specialized. There's certain ones that regulate the whole immune system. They become educated, and they're telling each little segment, each little branch of the immune system, if you see this, get rid of it, destroy it, destroy any cell that's infected with it. And it doesn't allow the virus to get a foothold. Now, we say it's 95% effective in preventing disease. So there's a difference between infection and disease. Infection means that, okay, it's gotten into your body. But disease means now it's reproducing in your body, and it's starting to cause problems, starting to cause inflammation and damage. In the studies, like, for example, the Pfizer vaccine, they had about 43,000 people that they had in this trial. And it was 170 of those 43,000 that became symptomatic with disease. And of those 170, 162 had gotten a placebo. So only 8 got disease. And that's in part how they came up with that 95%. So, I mean, it shows that, if you had that many people and say half of them got the placebo and half of them got the real thing, but you only had 8 people who got the real thing that actually got sick, that's very effective. I mean, it's really unprecedented. I don't think we have any vaccines that we have out there that are 95%. Well, I'll take it back. The Shingrix is like 98%, but still, it's a very effective vaccine. I know a lot of people talk about how did they come up with this so fast? Well, when we had the SARS outbreak and the MERS outbreak, which are coronaviruses, they started research then. That was under the Obama administration. But because it died down, they didn't move forward with the vaccine. But a lot of that basic research was done. They've also been trying to find a universal flu vaccine and using different types of approaches to that. So that also kind of plays somewhat of a role in this. There was tremendous, unlike other business entities, right? When they started developing this vaccine, the government said, we're going to pay for it. So they were funded ahead of time. So they didn't have to keep going back to investors to get more and more money. They knew from the get-go that they could start this process, and each phase of it was fully funded. There was no pauses. There were no meetings to say, hey, will you invest in this? Will you invest in that? Because it was all written. They basically had a check that was fully funded, and that made it go much quicker for that reason. In terms of the approval process, well, you have the Center for Disease Control, you had the Food and Drug Administration, you had an independent group of physicians that are not linked to any pharmaceutical company, that physicians, nurses, public health officials, completely independent, who reviewed it. And then on the state level, there was a second group just for the state of Illinois that also reviewed the facts before this got the EUA, the emergency use authorization coming forward. So there's a lot of different levels there that went over and reviewed the data. So these are 2-shot vaccines. And the reason that is because we want to get that secondary immune response. So for the Pfizer vaccine, the first shot gives you about 52% immunity, but the second second shot, you get that secondary immune response, meaning that it's like I've kind of already seen you, and I know you may be a troublemaker, but now I'm seeing you for the second time, and I know you are a troublemaker because of what you did the first time you saw me. So I'm coming after you. I'm bringing my brother, my sister, my friends, my coworkers. We all gonna gang up on you because we're not gonna have you causing any more problems. And that's what happens when you get that secondary immune response. The same thing with the Moderna vaccine. It's also a 2-shot vaccine, and you see one is week 1 and week 3. The other one is week 1 and week 4. So, Illinois has given out, I think, over 1 million doses at this point. We had our vaccine program at Franciscan over the weekend. We actually ran out of vaccine. We went through about 900, almost 1,000 doses in 5 days. I got my vaccine on Saturday. I had some soreness in my arm. Had a little bit of a low-grade temp. But it wasn't anything really bad. And I didn't miss any work or anything like that. And I talked to about 4 or 5 other people who generally did well. Some people had, my partner, he had no symptoms at all. So, and then moving on to the nursing home residents, obviously frontline workers, person with underlying illnesses. And Moderna is not indicated, I believe, for people under 18. And the Pfizer is not under 16 because they haven't had enough children in the trial, so they can't really do that. So these are like some of the symptoms that I talked about that people can get, from the studies. More people got symptoms with the second dose than the first dose, but the symptomatology was about 2%. I think it was about 2% for most of these. So pretty much, you're going to get some reaction. But getting a reaction is not a bad thing because it shows that your immune system's responding to it. So, why should you take the vaccine? Well, number one, this is highly contagious and it's spreading through the community. Certainly as a healthcare worker, you're at risk, but also in the community, you're at risk. I mean, it's just pretty much everywhere. And it's looking to attack you. It doesn't care about you or your mother or your father, your grandparents, your kids, it's out. You're the prey and it's like a predator in nature. I'm going to eat you up. I'm going to get out of you what I need and I'm going to keep it moving. Again, it stimulates and educates your immune system to recognize, seek, and destroy. You have no inherent immunity to COVID-19. It's 95% effective in preventing disease. Obviously, you've seen the economic devastation that has occurred. It's just getting worse and worse every day. And we need to get at least 70% herd immunity before we can really start reopening our economy. Protect yourselves, your family, your coworkers, and our patients. Our patients are very vulnerable at BRIA. I mean, these patients have multiple medical problems. Their immunity is not as strong as it once was. And, they're really susceptible. If you look at the statistics, about 1/3 of deaths from coronavirus have come in the nursing home population. It's about a 1 in 4 chance of them not surviving once they get infected. When you look at nursing home workers, it's much, 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 much lower. But you still should get vaccinated. So that's the current deaths, 323,000 as of yesterday. We're looking at more. People it's expected to be a bad winter. Everyone is pretty much saying that. It's a shame that people die without being able to see their families. The healthcare system is stressed to the max. Obviously, if we can contain the infection in nursing homes, that's less people having to go to the hospital. Because like I said, our system is really, really at the breaking point in multiple ways. And it's going to continue without mass vaccination. So, there's 2 paths to herd immunity. It's either vaccination or infection. That, 1 in 5 people will be seriously ill. The 1% or so will not make it. So really vaccination is by far the way to go. And even with infection, you don't know how long you're going to be immune to it. That's, at first I was saying, okay, well, I had it. Why do I need to be vaccinated? I'm going to be good, right? But that's, this vaccine has been studied, and it's going to give me a stronger immune response. It should be hopefully be much longer lasting and protect me and protect my family, because I have family members who haven't been sick. I have a brother who's much older than me, has some medical problems. I don't want to give it to him. And then, I list on the 4, you have all these different diseases that we've all been vaccinated against, most of us anyway: smallpox, polio, diphtheria, measles, hepatitis B, influenza. Vaccination is a great way of protecting yourself from disease. I mean, even when like a lot of people, I don't know if they understand it. Say, for example, you have a bacterial infection, the doctor gives you an antibiotic. A lot of us believe that, oh, that antibiotic, that really knocked it out. Well, all the antibiotic does, it gives your immune system a leg up on the infection, because it messes up or delays the reproductive cycle of, say, the bacteria. It slows it down. So it gives your immune system a chance to catch up and destroy it. The immune system is the closer. The immune system is the relief pitcher. So keep that in mind. So when you stimulate your immune system, you're protected a lot longer from these infections than otherwise you would be. Just the last line I share is, without vaccination, 70% of the population would have to recover from COVID-19 to halt the pandemic. Keys to victory: mask wearing, social distancing, staying at home, limit social contact. This is not the year to have a New Year's Eve party. This is not the year to have a big Christmas dinner. Okay, you can do that in the future. You'll be happier. You'll appreciate it a heck of a lot more because of this. Because by not doing that, you're going to have those people you love with you next year. Cleanliness of hands and surfaces. And also, one thing that we have to do is we have to be ambassadors as healthcare workers. When you get vaccinated, you need to let people know, hey, I got the vaccine. I feel great. I didn't have any major problems. I believe in it. I love you. I want you to get it too. Because a lot of times what people do is, like, if they have a side effect from the vaccine, it's in the church bulletin. Okay, everyone knows about it, even if it's not the vaccine that caused it. I have people coming all the time say, oh, I got this in 1975 and it almost killed me. So it's important that when you get the vaccination, that you do fine with it, that you let other people know. Because that's the only way we're going to get out of it. We have to be forceful, be respectful, but promote getting the vaccine.
Dr. Wallace, thank you very much for that excellent presentation. We appreciate it. I think it hits home the importance of vaccinating, understanding what we have to do to prevent it, but most importantly, at the end of the day, knowing that we have to be, your last line was sits with me in a great way, that we have to be ambassadors to the world and let them know how important it is, into our communities, into our families, to let them know how important it is to vaccinate. So it echoes with me and it echoes with our team, and I appreciate the time that you've given us tonight. I'd like to turn it over to Monica. She's got some frequently asked questions that our staff have been asking that maybe you can answer as she asks those questions. So Monica, if I could turn it over to you, please.
Sure. Well, you answered the first one very well already, which was, why should I get the COVID-19 vaccine? I think the whole presentation was about why, and that was very well said. Another common question is, are there any other incentives for me to get the COVID-19 vaccine? And Dr. Wallace, I'll take this one. Or Daniel, why don't you take this one? Because you've made quite an investment in our staff and quite an effort to show us how important it is to you and to BRIA corporate staff.
Well, I can't give you the clinical benefits.
Well, no, the incentive, the financial
incentive. So we're offering a $150 bonus, a safety COVID bonus to every employee that gets we call it the 2-step vaccine. So it gets week 1 and week 3 or week 1 and week 4. Once they're completed on the next payroll, they're going to get a $150 bonus. It's just because we recognize how important it is to vaccinate, and we're hoping to encourage every staff member to do it. It's hard to get people out and do it, but we definitely want to encourage them. So we're putting our money where our mouth is and telling everybody, please get vaccinated, because Our residents need you to, your families need you to, and you need you to. So we're putting the money where the mouth is to make it happen.
Thanks,
mean,
Daniel.
I would say that people need to understand that you will get infected, okay? You will get infected. You will let your guard down and you will get infected. I see people every week, in my own private practice, 5 or 6 a week, either getting a significant exposure or they come in and they're infected. A lot of people are infected and do not know it. And so you're taking this vaccine to prevent yourself from getting COVID-19 disease. It's 95% effective. Not only that, but chances are, it hasn't been proven yet, but chances are that you won't spread it to others. Now, when we started this testing at BRIA in Chicago Heights, one day we tested all the residents and next day we tested all the staff. And we didn't test all the staff in the same day, but the one day we tested 45 staff, 6 of them were COVID-19 positive, and they had no symptoms whatsoever. I mean, one way that this virus comes in is as people get infected outside, they come to work, and then that's, you can easily infect your coworkers, or patients. You don't intend to do it, but this thing is highly contagious. So keep that in mind. You don't want to have things happen that can be prevented.
If I can add to that, we all chose this profession because we're caregivers, right? And if we're caregivers, we have a responsibility, not only to ourselves, but like you said, to others. And by getting this vaccination, we are showing that we put that as number one, that us being caregivers and caring about others first is what we do. By getting that vaccine, you're caring about others and not only caring about yourself. So it's very important.
Another frequently asked question is the COVID-19 vaccine safe? Doctor, I know you spoke about the mRNA and how that vaccine was created, and I appreciate that because I think a lot of lay people don't understand why it was ready so quickly, and that causes skepticism, right? Because it was produced so quickly. So giving them that background was very helpful. It's also just important for people to know that this is not a live virus. That's always a little scary when it is. And because of this new way of creating this vaccine, it's not live. So you don't carry the risk of getting COVID from being vaccinated.
There's no part of the virus that's in the injection. What they did was that they sequenced the DNA of the virus, and then outside of that, they just took this one strand of genetic code. They put it with the mRNA. They programmed the mRNA in like a lipid with a lipid layer to make it easy to go into the cell. Once the mRNA delivers its message, it goes away. It's not there. It's not hanging around. I don't know, probably most of you are much younger than me, but I just think about it. Well, you've probably seen the movie Mission Impossible where the tape self-destructs at the end. Well, the mRNA just dissolves and is gone.
Thank you. Another frequent question asked is, what do I do about the vaccine if I have or had COVID-19? I know you talked about that as well. Because we don't want to infect our vaccinators when they come to our buildings to do the clinics, we will not be giving the vaccine to people who are positive and currently in transmission-based precautions. But once you come out of precautions, absolutely, we encourage you to get the vaccine because, as Dr. Wallace said, we don't know how long natural immunity is going to last.
Right. If you have like a mild case of it, your immune system is not going to be as motivated. So when you get it may not quite have the same message, the same encoding that you get from the vaccine. So, that's why I decided to get it. And I would recommend that, maybe you wait until you fully recovered if you are infected. And then, but eventually you should definitely get the vaccine. I'd probably say within 3 months, at the end of that 3-month period, you should probably get vaccinated.
The other common question, and I feel bad because you've answered all of these so well, Dr. Wallace, but another common one is just about the side effects of the vaccine. I know there's some fear about long-term effects that may not be known yet. So you touched on that. We do know that symptoms typically resolve in 1 to 2 days, and that it's also an indication that the vaccine is doing what it's supposed to do and our bodies are reacting how they're supposed to.
Yeah, I mean, the long-term effects you have to worry about is the long-term effects on the people who get the COVID-19 infection. I interviewed a lady about 2 weeks ago who had a fairly severe case. She had significant memory problems. Like, she was telling me how she'll say, like, hand me that cup. And instead of saying cup, she'll say something else like couch. People having heart problems, people having long-term lung problems. And you don't know, like, are you going to, there's a lot of people who have immunodeficiencies, but they don't know it. They're feeling great and they get hit with this virus. Their immune system has some sort of defect that was never diagnosed. And then they get super, super sick, and they get to the point where you get that cytokine storm when it damages your lungs. You wind up with permanent, cardiovascular problems. So when people really talk about, long-term effects, you should be much more concerned about long-term effects from infection as opposed to the immunization. I mean, like anything else, is risk. It's risk. Where's the risk coming from? Your risk comes from infection, not so much vaccination. I mean, we've been vaccinating people for years, all types of different technologies going into it. And you don't see, for 50 years we've been vaccinating people, 70 years we've been vaccinating people. You don't see a lot of people with these huge long-term problems from all these different vaccines. So generally it's safe. So people need to just keep that in mind, that you've been vaccinated multiple times, and it's unlikely that this vaccine is going to cause some effect. How would it even cause a long-term effect? Because it doesn't last. It doesn't stay around. It's just like a postal worker. It gives you the mail and then it leaves. So I don't know how it would really cause a long-term problem. I mean, there's always a possibility. And of course, there's a million things out there on Facebook or whatever, but you just follow the science. There's lots of go to reputable sources and stay on top of things, but listen to the scientist.
Very well said. People often ask, again, you covered this, but how many doses? It does require 2 doses. As Dr. Wallace said, the Pfizer vaccine is 21 days apart. The Moderna vaccine is going to be 28 days apart. Depending on which one Walgreens provides us with, we will provide you with the same brand. You're not allowed to have 1 dose of Pfizer and 1 dose of Moderna. So you do need to stay with the same vaccine brand whenever you get your first dose. Make sure that's your second dose. Anything to add on that, Dr. Wallace?
No, I would just say when you do get the vaccine, make sure that you get a good night's rest. Make sure you hydrate. Eat a good meal. This is not the time to stay up late watching Netflix. You get into bed. The next couple of days, get adequate rest, and that'll help to minimize any side effects.
Okay. And then it's funny to me, but people always are asking, once I get vaccinated, do I need to continue to wear a mask? And do I need to still do the weekly or biweekly testing? And the answer is yes. As you very thoroughly explained, we have to continue all of our prevention strategies, PPE, social distancing, testing plans until we get the herd immunity and can actually see a decrease in the virus.
Absolutely. It hasn't been shown as of yet to show that a person who's vaccinated can't possibly, you could possibly get infected and be contagious to others. I don't think that's the case, but it hasn't been conclusively shown that that's not the case. So you need to continue to mask up and do all those things as you've alluded to, Monica.
So we have a question. Many people ask if there are any contraindications, concerns with allergies, pregnancy, or other medical conditions.
It's contraindicated in pregnancy. It is, there's no doubt about that. In terms of allergies, if you're allergic to any of the ingredients in the vaccine, you shouldn't get it. If you have a history of anaphylaxis, you should consult your physician before getting it.
Some other guidance from the CDC is if you've had a severe anaphylactic response to any sort of injectable medication, you can still get the vaccine, but we're going to monitor you for 30 minutes instead of 15 minutes, just in case. That is injectables only. We're not talking about food. If you eat food that you're allergic to something, that is not contraindicated. If you've had the monoclonal antibody treatment for COVID, they do ask that you wait 90 days after that before you get the COVID vaccine. And the only other thing is that if you've had a flu shot within 14 days, they're just not sure how other vaccines are going to react with it. So it's not the end of the world, but they're not recommending that you have any other vaccines within 14 days of the COVID vaccine. Anything else to add on that question, Dr. Wallace?
I think you covered it well.
Okay. Another question is, will the vaccination likely be recurring like the flu vaccine? And from everything I'm hearing, yes. They don't know right now if it's going to be yearly or more frequently. Dr. Wallace, have you heard any other research on that yet?
I don't know. I think only time will tell. I mean, I think that they'll be doing research to see like what happens to people's antibody levels over time, if the antibody levels start to drop. I know some of the studies go out 2 or 3 years where they're drawing blood on patients who've been vaccinated to monitor their antibody titer.
Right.
So, I mean, I think that will tell us if you have a prolonged antibody titer, then the frequency of getting the vaccination should be lessened.
So more to come on that. I don't think the scientists know yet. So we will definitely keep you all apprised of that as we find out. And I don't see any more questions in the chat right now. And I believe we're right at the time, Daniel.
So I'll take it from here. Dr. Wallace, thank you very much for your presentation today. It truly enlightened us and helped us understand practical reasoning as to why we should take the vaccine. And hopefully our teams will be encouraged to do so. Monica, thank you for bringing some light to some of the questions, some of the answers. Both of your presentations were done great. Once again, today, everybody, we are here to encourage you to get vaccinated. You all saw firsthand through April and now again through November what the virus does. We as caregivers have the responsibility to protect our families, our residents, ourselves from this disease. At BRIA, we take this responsibility seriously and want to show you that. We're going to offer you again a $150 safety COVID vaccine bonus to every team member that completes the 2-step vaccine. The vaccine will be out in the next week to 2 weeks in your facility. The dates are flowing a little bit based on supply. Your administrator and your director of nursing will be giving you the details on that with all the forms that you need to fill out. Everyone, please help us turn the page on this virus by getting vaccinated. You're the ones that can make the difference. Thank you. Have a good night, everyone.
Thank you.
Thank you, Dr. Wallace.
You're welcome.